First aid program. First aid, definition, aid rendered to the victim, with the available means, material, till he is either taken to the hospital, or to the doctor for further treatment. Aims and objects: 1. To preserve life. 2. To promote recovery. 3. To prevent worsening. Qualities of a first aider: 1. Organizing ability. 2. Decisive. 3. Tact. 4. Patience. 5. Boldness. 6. Reassure the casualty. Line of action: check, causality conscious, bleeding, stop, burns, cooling, exclusion of air, fracture, immobilization, support, shock. Causality unconscious, breathing, not breathing. Artificial respiration, recovery position. Time for first aid. Structure of the body, bones of the human body. 1. Head and face, 8 plus 14 equals 22, 2. Upper extremity equals 64, 3. Ribs and breastbone, 24 plus 1 equals 25, 4. Backbone or spine equals 33, 5. Lower extremity equals 62, total bones, 206. Dressing and bandages, definition, a wound, or the injured part is covered, with the help of a piece of cloth is called dressing, or bandages. Aims and objects: 1. To arrest bleeding. 2. Protection to wound. 3. Prevent infection. Types of dressing: 1. Dry dressing, gauze, or lint, ready-made sterile dressing. Emergency and improvised dressing. 2. Wet dressing. 1. Triangular bandage. 2. Roller bandage, width 1 inch, 2.5 inch, 3.5 inch, 5 inches, and 6 inch. Use of bandages: 1. Large arm sling, to support forearm, palm, fracture of ribs. 2. Small arm sling, to support wrist, palm. 3. Triangular sling, fracture ribs, collarbone. 4. Cuff and collar sling, injury to fingers to raise the hand, fingers. 5. Clove hitch. 6. Reef knot, this can be remembered by the slogan, left over right, and under, right over left, and under. Use of bandages: arm sling. Triangular bandage. Cuff and collar. Bandages, general rules for application. 1. Face the casualty. 2. Hold the head of the bandage in the right hand when bandaging a left limb and vice versa. 3. Bandage firmly from below upwards. 4. Take each layer of the bandages to cover 2/3 of the earlier turn. 5. Bandage should not be too tight or loose. Tie the knot opposite side of the wound. This system consists of heart, arteries, capillaries, and veins. Quantity of blood in normal adult is about 5 liters. Contents of blood: red blood corpuscles, RBC, round, carrying O, white blood corpuscles, WBC, irregular, body soldier. Platelets, clotting of blood, clotting time, 2 minutes, plasma. Circulation of blood, function of the blood. 1. Carrying oxygen to the body tissue. 2. Maintain body temperature. 3. Form clotting. 4. carrying plasma to every body part. Type of blood circulation: 1. Pulmonary circulation, 2. Systemic and general circulation. Heart structure: heartbeat 72 to 80 times minute, pulmonary circulation, general circulation. Wounds and hemorrhage, bleeding, classification of wounds: 1. Incised wound, caused by sharp instruments like knives, razor, etc. The blood vessels are clean cut and so these wounds bleed extensively. 2. Lacerated wound, caused by fall on rough surfaces, machinery, etc. These wounds have torn or irregular edges. 3. Contused wound, caused by blows from blunt instruments or by crushing. The tissues look bruised. 4. Punctured wound, caused by needle, knife, or sharp-pointed instrument. General rules for treatment: 1. Place a casualty in a suitable position. 2. Elevate the bleeding part. 3. Do not open any blood clot. 4. If possible, remove foreign body from wound. 5. Apply and maintain direct or indirect pressure to arrest the bleeding from wound. 6. Observe the utmost cleanliness to prevent the entry of hazardous germs to avoid infection. Internal hemorrhage, bleeding: 1. Visible hemorrhage, types: 1. Vomit, from stomach in case of ulcer, color of the blood is coffee brown. 2. Spittoon, from the lungs in case of T.B, color of the blood is bright red. 3. Motion, piles upper bowel, color of blood is red, color tar black. 4. Urine, kidney, or bladder, color smoky white. 2. Visible hemorrhage, sign and symptoms: 1. Face and lips becomes pale. 2. Skin cold and clammy. 3. Patient feels faint or dizzy. 4. Pulse rate becomes weaker. 5. Victim complaint of thirst. 6. Breathing becomes shallow, air hunger. Treatment: 1. Keep the casualty warm. 2. Do not give anything by mouth. 3. Remove the casualty to the hospital without a moment's delay. Shock. Shock is due to the sudden loss of blood, plasma, tissue fluid. Cause of shock: 1. Major injuries. 2. Fracture in the thigh. 3. Severe burns. Type of shock: 1. Emotional shock due to emotion. 2. True shock due to sudden loss of body fluid. Sign and symptoms: 1. Giddiness and faintness. 2. Coldness. 3. Nausea. 4. Pallor. 5. Cold, clammy skin. 6. Pulse slow in the beginning, later tends to become rapid. 7. Vomiting. 8. Unconsciousness. General treatment: 1. Reassure the casualty. 2. Lay him on his back, with head low position but not in case of spinal cord injury. 3. Loosen clothing around the neck, chest, and waist. 4. Keep him warm, wrap him in blanket or rug. 5. If he is conscious, give him water, tea, or coffee. 6. Take the casualty to the hospital without a moment's delay. Asphyxia. Asphyxia is caused by insufficient supply of oxygen to vital organs, an important nerve system of the brain. Cause of asphyxia: 1. Drowning. 2. Harmful gases like coal gas, motor exhaust, etc. 3. Solid article in air passage, for example, false teeth, tongue falling back in case of unconscious casualty, etc. 4. Hanging, strangulation, etc. 5. Smothering, for example, overlaying the infant. Sign and symptoms, early stage, 1. Dizziness and weakness, 2. Shortness of breath. 3. Rapid pulse, 4. Partial loss of consciousness. 5. Swelling of veins of the neck. 6. Congestion of the face, with blueness of cheeks and lips. Later stage, 1. The lips, nose, ears, fingers, and toes are bluish-gray. 2. Breathing intermittent or absent. 3. Pulse slow and irregular. 4. Complete loss of consciousness. General rules for treatment. 1. Remove the cause if possible, or casualty from the cause. 2. Ensure that there is a free passage for air. 3. Start artificial respiration, ARR, immediately as every second counts. 4. Keep casualty warm, for example, wrap him in a blanket. 5. Call for medical help immediately, or remove him to the hospital. While on way to hospital, AR may be kept continued. Fracture, definition. Fracture means cracking, bending, or breaking of the bone. It may cause by direct force, for example, crush by a wheel, or indirect force, for example, fracture of a collarbone by falling on the hand. Types of fractures: simple, transverse, compound, open, comminuted, spiral, impacted, greenstick. Signs and symptoms: 1. Severe pain at site of the fracture, or nearby. 2. Swelling at the spot of the fracture. 3. Loss of power, movement of particular part. 4. Deformity of the limb. 5. Crepitus, bony grating, may be heard, or felt. General rules for treatment. 1. Treat the fracture on the spot as far as possible. 2. Bleeding, and the severe wound to be taken care of first. 3. Immobilize the fracture part, by using bandages, or by using splint. Unconsciousness. Unconsciousness is caused, due to interruption of the action of the brain, through some interference, with the function of the nervous system. Common cause: 1. Shock. 2. Asphyxia. 3. Poisoning. 4. Epilepsy. 5. Effect of excessive heat. 6. Fainting. 7. Brain injury. 8. Heart attack. General rules for treatment. 1. Clear the air passage first, for example, remove false teeth, froth, loosen the clothes around neck, chest, waist. 2. Remove the harmful gases. 3. Keep back the crowd, open doors and windows for supply of abundant fresh air. 4. If breathing appears to have been failing, start AR immediately. 5. Put him in 3/4 prone position. 6. Wrap him in blanket to keep him warm. 7. Do not give anything by mouth. 8. Send for medical aid and if necessary arrange for his removal to hospital. 9. After regain consciousness, give him water sip by sip if there are no abdominal injury. Effect of excessive heat. Detail: heat exhaustion, heat stroke, Cause: when surroundings are hotter than the body, it results into deficiency of fluids and salt. Follow heat exhaustion. Signs and symptoms: headache, dizziness, vomiting, unconsciousness, pulse is weak, face is pale, headache, vomiting, unconsciousness, skin hot and dry. Treatment: 1. Bring in a cool place. 2. If conscious, give plenty of salt water. 3. If require, wrap blanket. 4. Watch if the conditions are changing to heat stroke. 1. Bring in a cool place. 2. Remove clothing, sprinkle water. 3. If require, wrap with wet blanket. 4. After lowering the temp, wrap with dry blanket. Fainting: this condition appears due to insufficient supply of blood to the brain. Common cause: 1. Fright. 2. Bad news. 3. Horrifying sight. 4. Severe pain. 5. Long period of sitting or standing in a hot. Treatment: 1. Head low position. 2. Loosen clothing at the neck, chest. 3. Give smell of salt volatile, or onion, or smelling salt. 4. Insert a spoon wrapped in handkerchief between his teeth to prevent locking of jaw. Poisons: snakebite, sign and symptoms: puncture marks, or parallel scratches on the skin, rarely any pain, pale, cool skin, with progressive onset of sweating. Rapid, weak pulse, rapid, shallow breathing, breathing difficulties, blurred vision, drooping eyelids, difficulty swallowing and speaking, vomiting, headache, collapse, progressing to a comatose state. Treatment: apply a constructive bandage on the heart side of the bite. However, release the bandage after 15 minutes for 5 minutes. Take a new blade, heat it on a flame, or dip in spirit, and, with this sterilized blade, cut, and make the wound deeper to encourage bleeding, to wash the venom from the bite. Wash the wound with potassium permanganate. If there is no wound in the food passage mouth, then suck the wound and slit out the poison. Encourage the patient: if he is conscious, then give tea or coffee sip by sip. On failure of breathing, start a doctor immediately. Seek medical aid immediately. Burn and scalds: burn due to dry heat, for example fire, hot metal sheet, sun heat, etc. Scald due to wet heat, for example hot milk, steam, hot oil, etc. Degree-wise classification of burns: first-degree burn, the skin is reddened; second-degree burn, there are blisters on the skin; third-degree burn, there is destruction of deeper tissues, with scarring. Degree-wise classification of burns: burn. Rules of 9. 1. 1 hand 9%, 2 equals 18%, 2. 1 leg 18%, 2 equals 36%, 3. Chest and abdomen equals 18%, 4. Whole back equals 18%, 5. Neck, face, and head equals 9%, 6. Genetics equals 1%, total equals 100%. Treatment: 1. Clean your hands thoroughly. 2. Do not apply any ointment, specially in case of second and third degree burn. 3. Do not remove burned clothes. 4. Do not break blisters. 5. Bandage firmly if blisters are absent. 6. Put light bandage if blisters are present. 7. Treat shock. 8. In case of extensive burn, do not give anything by mouth. 9. Observe utmost cleanliness to avoid infection, which is most important. 10. Arrange of transport of casualty. Treatment for chemical burn. 1. Wash off the chemical with a large quantity of water by using a shower or hose if available as quickly as possible. 2. This flooding with water will wash away much of the irritants. 3. Cut out contaminated clothing. 4. Do not touch the burnt area. 5. Treat as for burns. Artificial respiration, cardiopulmonary resuscitation, CPR, use when heart is not functioning, breathing is not there, for example, electric shock. Holger-Nielsen method, use when heart is functioning, breathing is not there, for example, drowning. Cardiopulmonary resuscitation, CPR. 1. Determine if patient is conscious by tapping and shouting, "Are you okay?" 2. If no response, position the patient on his back. Open the airway with a head tilt chin lift or jaw thrust maneuver. 3. Look, listen, feeling for breaths. Check breathing for 5 to 10 seconds. 4. If they aren't breathing, ventilate twice. 5. Check for a pulse by palpating, feeling the carotid artery. Check the pulse for 10 seconds. 6. If there is no pulse, begin chest compressions at a rate of 15 compressions to 2 breaths. 7. Recheck the pulse after 1 minute. Continue until help arrives, or until you feel too tired to continue. Holger-Nielsen method. 1. Place the victim face down, elbows bent, one hand on the other, with the face turned to one side. 2. Place your hands, thumbs touching, just below a line running between the armpits. 3. Rock forward slowly, elbows straight, until arms are vertical. 4. Rock backward, sliding your hands to the victim's arms, just above the elbows. 5. Raise the arms until resistance and tension are felt at the victim's shoulders.